Today we are talking about stomach ulcers, or more accurately, we're talking about peptic ulcer disease. But I'm going to break it all down for you guys. I'm Dr. Jen Caudle. It's good to see you. All right, so we're talking about ulcers in the stomach area. An ulcer is kind of a sore that develops in the lining of the stomach or the upper part of the small intestine. Okay, so when the ulcer is in the stomach part, it's actually called a gastric ulcer. When it's in the first part of the small intestine, called the duodenum, it's called a duodenal ulcer. Duodenal ulcers are actually the more common of the two, but either way, the problem's the same. It's the protective lining of the stomach duodenum breaks down, acid irritates the tissue underneath, etc. Now, this is a condition, this peptic ulcer disease, that affects a lot of people, so that's why we're talking about them. And let's start by talking about what causes them. You might be surprised to know that there are two main culprits. The first, believe it or not, is a bacterial infection from a bacteria called H. pylori. This is a germ that lives in the stomach lining. About 42% of ulcer cases are linked to this bug. It's actually a more common cause of duodenal ulcers than stomach ulcers, by the way. I have a whole video on H. pylori. The second is a pain medicine called NSAIDs. Now, I know you're familiar with this, non-steroidal anti-inflammatory drugs. Lots of these, ibuprofen, etc., over the counter. Also naproxen, that is another one. Oh, and aspirin as well. These medications can weaken your stomach's protective barrier. And about 36% of ulcers are caused by these medications. That's always why we tell you to be cautious with them. Tell your doctor about everything and anything you're taking. NSAIDs tend to cause more stomach ulcers than duodenal ulcers, actually. So that's important to keep in mind. Okay, what are some of the risk factors with peptic ulcer disease? Okay, so let's think about some of the things we just talked about, the NSAIDs. Taking those types of medications regularly, especially many at a time, can be a problem. Taking aspirin along with a blood thinner could put you at risk. Having an H. pylori infection, we talked about H. pylori. If you're an older individual, being a smoker, and then if you use NSAIDs and have H. pylori at the same time, that combination dramatically increases the risk. Sometimes underlying psychological stress that's significant could potentially be a risk factor. There's many different things, but symptoms, the most common symptom is a burning or gnawing pain in your upper belly, kind of right below the breastbone. About 80% of people with ulcers will experience that, but other symptoms are things you might be familiar with, things like heartburn or acid reflux, feeling bloated or full quickly after eating. Some people feel nauseous. And a classic pattern that tends to be more common with duodenal ulcers is actually feeling hungry or having pain at night or on an empty stomach that gets better after eating, then comes back 2 to 3 hours later. With stomach ulcers, it's actually different. Eating may actually make the pain worse. So that's a big difference between duodenal and stomach ulcers in terms of symptoms. Now, warning signs, these are warning signs whether or not you have an ulcer or think you do. These are always warning signs, like vomiting blood, totally a warning sign. No matter if it's bright red blood or coffee ground, meaning dark black. Black tarry stools, always a warning sign. Sudden severe abdominal pain, to me, that's always a warning sign. Unexplained weight loss, meaning you're losing weight and you don't even know why, always a warning sign, no matter what you think may be going on or not. And keep in mind that about 9% of people with ulcers actually have no symptoms at all. Oftentimes in that situation, the ulcer is actually found incidentally or found when you weren't even looking for it. We weren't looking for it. There are ways to test for ulcers. Obviously, we doctors have non-invasive tests as well as endoscopy, which is the gold standard, okay, where a doctor puts a scope down and literally takes a look. They can take tissue samples, they can biopsies, just all sorts of good stuff can happen with endoscopies and stuff to take a look. So that is a good thing. And there is treatment, right? There is good news in that front. Both types of ulcers are actually very treatable. Some things we will often use acid-reducing medications like proton pump inhibitors that will help allow the tissue to heal, the ulcer to heal, things like that. If you have H. pylori, we may give you a combination of medications, a proton pump inhibitor plus antibiotics that you may have to take for a certain period of time. If non-steroidal anti-inflammatory drugs are the cause, obviously stopping those is going to be helpful, but your doctor may also prescribe other medicines to help protect your stomach. Lifestyle changes are always a good thing. Things like quitting smoking. Don't start smoking if you don't. Limiting alcohol, unnecessary NSAID use. That's always important. And, the bottom line here is to understand that keeping our stomach healthy is super, super important. If you have any questions or concerns about ulcers, wondering if you have one, or if you just have any symptoms that are not your normal, see your doctor, because we want to make sure that none of this stuff is going on. And if it is, that we fix it and we help you get better right away. Guys, I'm Dr. Jen Caudle, practicing family physician, on-air health expert and video creator. I do daily videos on like all the things. Please like and follow my page. I'm on Facebook. I'm on YouTube. Please subscribe to my channel on TikTok, Instagram, LinkedIn, WhatsApp, all the things. And sign up for my free health newsletter at drjencaudle.com.